What if I told you that spending just 4 to 6 minutes a day, no gym, no equipment, no expensive supplements, could protect your heart, sharpen your mind, strengthen your bones, and possibly add years to your life? And what if the exercise I'm talking about is one you've known about since grade school? Most people over 60 have completely written it off. They think, I'm too old for that, or my joints can't handle it, or maybe they just haven't thought about it in decades. But new research is changing everything we thought we knew about this simple, ancient movement. And the results for people over 60 are genuinely remarkable. Stay with me, because what you're about to learn might be the most important 4 minutes of your day. Welcome back, friends. If you're new here, this channel is dedicated to one thing: helping you live longer, stronger, and healthier, especially in your 60s, 70s, and beyond. Today, we are talking about push-ups. Specifically, what happens to your body when you do just 25 push-ups twice a day. That's 50 push-ups total, broken into 2 easy sessions, maybe one in the morning, one in the evening. Takes about 3 minutes each time. Now, before you say, I can't do a push-up, I want you to stay with me, because there are modified versions of this exercise that work beautifully for seniors, and I'll walk you through every single one of them. But first, let's talk about why this matters so much for people over 60. Because after the age of 60, your body starts changing in ways that most people don't fully understand. And many of those changes can be slowed down or even partially reversed with the right kind of daily movement. Let's get into it. Slightly more serious, educational tone, like a trusted doctor. Here's something your doctor may not have sat down and fully explained to you. After the age of 30, the human body naturally begins to lose muscle mass. Slowly at first, maybe 3 to 5% per decade, but after 60, that process speeds up. Scientists call it sarcopenia, and it simply means age-related muscle loss. Now, why does muscle loss matter so much? Because muscle isn't just for lifting heavy things. Muscle is what keeps you standing up straight. It's what prevents falls. It's what keeps your metabolism working properly. And here's the one that surprises most people. Muscle is directly connected to your heart health, your blood sugar control, and even your ability to think clearly. When your muscles weaken, everything else starts to suffer too. And here's the thing most seniors don't realize. The muscles in your chest, your shoulders, your arms, and your core, exactly the muscles that push-ups work, are some of the first to go. They're called your pushing muscles, and losing them is directly linked to poor posture, shoulder pain, difficulty getting up from the floor, and reduced upper body strength. So when we talk about doing 25 push-ups twice a day, we are not just talking about building a little muscle. We are talking about protecting your independence, protecting your quality of life, and yes, protecting your heart. Build a little excitement here. This is a powerful fact. Let's start with the benefit that might surprise you the most. Back in 2019, researchers at the Harvard T.H. Chan School of Public Health published a landmark study. They followed over 1,100 active men for about a decade, and what they found was stunning. Men who could complete 40 or more push-ups in a single session had a 96% lower risk of cardiovascular events, like heart attacks, compared to men who could do fewer than 10. Now, that study was primarily on men, and it used 40 push-ups as the benchmark. But here's what's important for you. The relationship between push-up capacity and heart health was linear. That means the more you could do, even if it was just a modest number, the better your heart outcomes. 25 push-ups, twice a day, that is building genuine cardiovascular protection. Why? Because push-ups are what exercise scientists call a compound movement. That means they work multiple muscle groups at once. Your chest, shoulders, triceps, core, and even your legs are engaged. When multiple large muscle groups work together, your heart has to pump more blood, more efficiently. Over time, this strengthens the heart muscle itself. Think of it like this. Your heart is a muscle, and like any muscle, it gets stronger when you challenge it regularly. Push-ups give your heart a safe, consistent challenge, without the high impact of running or jumping. Warm, reassuring tone. Pause before each numbered benefit. Now let's talk about what happens to your muscles and bones. And this is where it gets really exciting for seniors. Benefit number 1. You rebuild strength you thought was gone forever. Many seniors believe that once you've lost muscle, it's gone. That is simply not true. Research consistently shows that the body, even at 70, 80, or beyond, retains the ability to build new muscle tissue in response to resistance exercise. Scientists call this muscle hypertrophy, and it happens at any age. 25 push-ups twice a day applies enough resistance to trigger this rebuilding process. Within 4 to 6 weeks of consistent practice, most people notice their arms and shoulders feel stronger. Tasks that used to feel difficult, pushing open heavy doors, getting up from the floor, lifting grocery bags, start to feel easier. Benefit number 2, you protect your shoulder joints. As we age, the tendons and ligaments around the shoulder can become stiff and prone to injury. One of the most common complaints among seniors is shoulder pain, often from what doctors call rotator cuff degeneration. Push-ups gently strengthen the muscles surrounding the shoulder joint, providing better support and protection from the inside out. Many physical therapists actually recommend modified push-ups as part of shoulder rehabilitation programs for exactly this reason. Benefit number 3. You slow down bone density loss. You've probably heard about osteoporosis, the thinning of bones that affects millions of Americans over 60, especially women. What many people don't know is that weight-bearing exercise is one of the most powerful tools we have for preserving bone density. When you do a push-up, you are literally bearing your own body weight through your arms and wrists. This mechanical stress sends a signal to your bones: stay dense, stay strong. Over time, consistent push-up practice can help slow the rate at which your bones thin, reducing your risk of fractures. Here's a benefit that doesn't get nearly enough attention. What happens to your brain when you do push-ups twice a day? A lot, actually. When you engage in resistance exercise, which is exactly what push-ups are, your body releases a remarkable protein called BDNF. That stands for brain-derived neurotrophic factor. Scientists sometimes call it miracle grow for the brain because it literally stimulates the growth of new brain cells and strengthens the connections between existing ones. Higher levels of BDNF are associated with better memory, sharper focus, reduced risk of dementia, and improved mood. Here's what's really important for you to hear. You do not need to run a marathon to get this benefit. Even moderate resistance exercise, like a set of push-ups, triggers BDNF production. And the more consistently you do it, the more your brain benefits over time. Several studies have now linked regular strength training in older adults with measurable improvements in cognitive performance. In other words, doing your push-ups every day isn't just making your arms stronger. It is quite literally helping protect your brain. And there's another brain benefit that nobody talks about enough. Mental confidence. Many seniors quietly deal with a fear of falling, a fear of losing independence, a quiet anxiety about getting older that they don't always put into words. When you build physical strength, when you feel your body respond and grow stronger, something shifts on the inside too. There's a sense of agency, a feeling of, my body still works, I can still grow, I am not finished. That feeling is powerful. And it is very, very real. Now let's talk about blood sugar, weight, and metabolism, because this one matters enormously for seniors, especially the millions of Americans over 60 who are managing type 2 diabetes or prediabetes. Here's the connection. Muscle tissue is the largest consumer of blood sugar in your entire body. When you have healthy, active muscle tissue, your body is much better at clearing excess glucose from your bloodstream after meals. When you lose muscle, as many seniors do, your blood sugar control gets worse, and your risk of diabetes complications rises. By building and maintaining muscle through daily push-ups, you are essentially giving your body a bigger, more efficient engine for burning blood sugar. Many people with type 2 diabetes who add resistance exercise to their daily routine report measurable improvements in their blood sugar numbers, often within just a few weeks. And what about metabolism? Here's something important. Muscle tissue burns more calories at rest than fat tissue does. So, as you build muscle through push-ups, your resting metabolism, the rate at which your body burns energy just to keep you alive and functioning, actually goes up. This makes it easier to maintain a healthy weight even as you age. This is exactly why so many doctors and nutrition experts recommend resistance exercise as part of any weight management plan for seniors. I want to pause here for just a moment. If you are over 60, or if you are caring for an elderly parent or a loved one, the information in this video could genuinely be life-changing. Not because push-ups are some kind of magic, but because consistent daily movement, even in small amounts, has the power to protect your heart, your brain, your bones, and your independence in ways that most medications simply cannot match. If this is resonating with you, I'd like to ask you to do one small thing right now. Hit the like button on this video. It tells YouTube that this kind of content matters, and it helps us reach more seniors and families who need to hear this message. Now, let's keep going, because I still need to show you exactly how to do this safely if you're over 60, including the modified versions that work for every fitness level. Friendly, clear, step-by-step tone, like a patient coach. This is where we get practical, and I want to be very clear about something right from the start. There is a version of this exercise that works for you, regardless of your current fitness level. You do not need to get down on the floor. You do not need strong wrists. You just need a wall. Let's go through the 5 levels. Level 1, wall push-ups. This is the perfect starting point for beginners, anyone with joint issues, or anyone who simply hasn't exercised in a while. Stand about 2 feet away from a wall. Place your palms flat on the wall at shoulder height. Slowly bend your elbows and lean your chest toward the wall, then push back to the starting position. That's 1 rep. Wall push-ups are low impact, gentle on the wrists and shoulders, and they still provide meaningful muscle activation throughout your chest, arms, and core. Many physical therapists start their senior patients right here. Level 2, counter or table push-ups. Once wall push-ups start to feel comfortable, move to a sturdy kitchen counter or a solid table. Same exact movement, but the lower angle increases the challenge and works your muscles a little harder. Just make sure the surface is stable and will not slide. Level 3, incline push-ups. Use a low bench, a step, or even the arm of a couch. Place your hands on the elevated surface and do your push-ups with your feet flat on the floor. This is a very effective variation that is still much gentler on the wrists than getting down on the ground. Level 4, knee push-ups. Lower yourself down to your knees on a soft mat. Hands slightly wider than shoulder width apart. Lower your chest slowly toward the floor, then push back up. Keep your back straight throughout. No sagging in the hips. This is the classic modified push-up, and it builds real strength quickly. Level 5, full push-ups. Toes on the floor, hands shoulder width apart, body in a straight line from your head to your heels. Lower slowly, pause for a moment at the bottom, then push back up. If you can do these comfortably, excellent. But please, no ego here. Form matters far more than quantity. A slow, controlled push-up at level 3 is far more valuable than a sloppy, full push-up done wrong. Now, before we move on, I want to give you 4 safety tips that every senior should follow. First, always warm up. Before you begin, do a few arm circles, some shoulder rolls, and gentle wrist rotations. Cold muscles and stiff joints are much more prone to injury than warmed-up ones. Second, breathe. This sounds obvious, but many people hold their breath without realizing it during exercise. Here's the rhythm. Exhale as you push up, inhale as you lower down. Nice and easy. Third, know the difference between fatigue and pain. Mild muscle fatigue is completely normal and actually a good sign. But sharp, localized pain in your shoulder, wrist, or elbow is a signal to stop and rest and to speak with your doctor if it continues. Fourth, start wherever you are. If 25 feels like too many right now, start with 10. or even 5. Do them twice a day, every day, and build up gradually over time. Consistency beats intensity every single time. Motivating, simple, encouraging tone. Make it feel doable. Here's the beautiful thing about 25 push-ups twice a day. It is small enough to actually do every single day, and that is the entire secret. The biggest mistake people make with exercise is trying to do too much too soon. They go hard for 2 weeks, get sore or tired, then quit. Then they feel guilty about quitting. And then the whole exhausting cycle starts over again. We are not doing that. Here is your simple 2-part daily plan. Morning session. Right after you wake up and use the bathroom, before your coffee, before breakfast, do your push-ups. It takes 3 minutes. You are starting your day with a win, and that win sets the tone for everything that follows. Evening session. Before dinner or right before you settle in to watch your evening television, do your push-ups again. 3 minutes. That's it. You do not need a gym. You do not need any equipment. You do not need a special outfit or a trainer or a membership or a plan. You just need 3 minutes, twice a day, and the decision to show up for yourself. Many seniors who start this habit tell me that within 2 weeks, they notice they're sleeping better. Within a month, they feel stronger and more energetic. Within 2 to 3 months, their doctors start commenting on improvements in their blood pressure, their blood sugar, and their overall vitality. Small habit, big results. Caring, serious tone. This is an important segment. Before I wrap up, I want to address something important, because I know many of you watching are managing existing health conditions, and that is perfectly okay. Push-ups are generally very safe for healthy older adults, but there are situations where you should speak with your doctor before beginning any new exercise program. Please check with your physician first if you have been recently diagnosed with a heart condition, if you have had recent surgery on your shoulder, arm, or wrist, if you have severe osteoporosis, or if you have ever been advised by a medical professional to avoid resistance exercise for any reason, and during exercise, at any level, if you experience chest pain, chest tightness, dizziness, severe shortness of breath, or any pain that radiates down your left arm, stop immediately, sit or lie down, and call 911. These can be signs of a cardiac event, and they require immediate medical attention. Please do not wait. For most seniors, however, modified push-ups performed at a gentle, controlled pace are not just safe, they are actively recommended. The American Heart Association and the Centers for Disease Control both advise that adults 65 and older should include muscle-strengthening activities on 2 or more days per week. What we're talking about today, this is that activity. Let's bring everything together. When you do 25 push-ups twice a day, here is what starts happening to your body. Your heart gets stronger. The cardiovascular benefits of regular push-ups are well documented, and research shows a clear link between upper body strength and a significantly reduced risk of heart disease. Your muscles rebuild. Sarcopenia, age-related muscle loss, can be slowed and even partially reversed at any age through consistent resistance exercise. Push-ups are one of the most accessible and effective ways to do this. Your bones stay denser. The mechanical stress of bearing your own body weight signals your bones to stay strong, reducing your risk of osteoporosis and fractures. Your brain gets sharper. The release of BDNF through exercise helps protect your memory, your focus, and your emotional well-being. And it reduces your long-term risk of cognitive decline. Your blood sugar improves. Building active muscle tissue improves your body's ability to manage insulin and glucose, something critically important for the millions of seniors managing diabetes or pre-diabetes. And perhaps most importantly of all, you feel stronger, more confident, more in control of your own health and your own life, all from 3 minutes, twice a day. You do not have to be an athlete. You do not have to be young. You just have to start. Wherever you are right now, whatever level you begin at, wall push-ups, knee push-ups, or full push-ups, the most important thing is that you begin. Your body is more capable than you think, and it is never, ever too late to get stronger. If this video gave you something useful today, if it inspired you, informed you, or made you think, I want to ask you to do 3 things before you go. First, hit that like button right now. It genuinely helps this channel reach more seniors and families who need this information, and it only takes 1 second. Second, subscribe if you haven't already. We put out new senior health content every single week, and we always make it practical, honest, and easy to understand, because that's what you deserve. Third, share this video. Send it to a friend, a sibling, a parent, or anyone in your life who is over 60 and who deserves to feel their very best. You might just inspire someone you love to start a habit that truly changes their life. And finally, I would love to hear from you in the comments below. Are you going to try 25 push-ups twice a day? Which level are you starting at? The wall, the counter, the knees? Leave a comment and let me know. I read every single one. And your stories inspire this entire community. Take care of yourselves. Get moving. You have absolutely got this. I'll see you in the next video.